One of my favorite new partners is Warrior Salt. We talk on the show. We're trying to empower you to mind, body, and energy. Energy starts with being hydrated. Let me tell you, after a workout and with eating, if you're eating a healthy diet, it's hard to get enough sodium. Well, you wouldn't believe it. We were coached for so long that sodium's bad, but that's why I love this partner. No BS, just electrolytes. They keep it simple. We're talking about fruit powder and salt. There's no stevia, no citric acid, none of the bad stuff, just the stuff you need to stay hydrated. That's what I'm doing. I go to a workout, before workout, after workout. You need it both. If you're thirsty, you've waited too long. That's the point. With Warrior Salt, again, it's all about simple hydration that you need without anything that you don't want. One of the official partners here of Vibe Science as we take you to your highest vibe.
This is Vibe Science, a top 100 wellness podcast presented by the Radcast Network, breaking wellness barriers and making health truly personal. Here are your hosts, Ryan Alford and Chris Hansen.
Hello, and welcome to Vibe Science. We're always here to empower you to your highest vibe. It's about mind, body, energy. And today, we want to get you triggered a little bit. That'll make more sense as we move along. And, I'm Ryan Alford, your host. I've always got one of my best friends, my Kimasabe down in Miami, Chris Hansen. What's up, Chris?
What's up, bro? How you doing today?
I'm good, man. I'm ready to get triggered, ready to talk the pain game.
That's
but,
right.
you know what we like to do? We like to bring it from all the angles. A lot of people suffer from pain, and it's never been a better time to be educated on what the options are. And so, we'll go straight to the source. We got specialist, Dr. Jordan Barber. He is a pain specialist. He's known for all the alternative ways, and he's an acupuncturist. We appreciate him for coming on the show. Hey, Jordan, it's good to have you.
Hey, Ryan. I love that introduction. And hey, Chris, I'm really excited to join you guys today.
Yeah. This is a fresh topic for us. We cross the gamut across wellness, mindset, that mind, body, energy. And it pains me, not even jokingly. It's not even a joke, but I literally think about this from time to time because I've had friends, I've had family watch them be in pain. And it is a terrible existence. And a lot of people have to go through it. So I'm excited to share with them knowledge and learn from you, everything you're doing in that space, because I'm sure it's rewarding for you watching, probably how you've helped treat people, educate other, practitioners and other things. So excited to hear about it.
Yeah, I'm excited to share. I mean, when we talk about pain, especially chronic pain, it's higher per incidence than diabetes, than hypertension. It's about 51 per 1,000 people every year have chronic pain. So it's a major topic, and a lot of times people aren't aware of the solutions that are out there.
Yeah, that's the problem. And, we try to stay away from throwing shade, on either side. But I think the one area that we probably would throw shade is in, the pharmaceutical space with pain. Yeah. I want to think and believe, and, lucky enough to not, be in this space right now or having, be on pain medicine or take it. So I can only know what I read. Seems to have improved maybe a little bit, but I don't know. You would know better than me. It does just seem like we've just thrown pills at everything.
So I think it's about 10% of the U.S. population, adult population, every 30 days takes some sort of prescribed pain medication, based on one of the recent studies I looked at. That's a significant amount of people taking a prescription medication. So we're not talking about Advil. We're not talking about aspirin, right? And we have to differentiate between acute pain, where I think there's a time and place for pain medications. If you're in a car accident, you broke a bone, or you just come out of surgery, there's a need, obviously. But when we go into chronic pain, when we're moving from that acute stage, we really have to think about those long-term solutions of weaning people off medications or using them only when it's needed, maybe when something flares up. And I think that's where the awareness and the what we call systems-based medicine, or the medicine that we have now, doesn't really excel. They'll send you maybe to PT. And if you look at how insurance works these days, the insurance really isn't paying well for physical therapy. So the physical therapists, who most of them are incredible and quite knowledgeable on the subject, aren't paid to spend the amount of time they need to spend with you to give you the care you need. So we have a broken system when it comes to chronic pain. And I don't want to point the fingers of the insurance industries or the pharmaceutical industry, but they're all to blame. It's a difficult situation.
You call a spade, so my mom would say.
I believe I'm in the laboratory testing space, working with doctors all over the country, and pain doctors being a big part of that. And there is no solutions in those clinics. I see sick people in the waiting room that are basically just addicted to pills, honestly. And unfortunately, a lot of these people have other health problems, whether it's compounded because of the pain meds or vice versa. But it's almost crazy when I think about it, of none of these people are being presented any solutions, literally, besides surgery and opioids for the rest of your life. That's the two basically.
There's a lot I can say there, and I want to pick my words and choose them correctly.
Oh, don't pick them, Doc. Go right at it.
Well, I'm known to be controversial, but there's a lot of cofactors that go with pain. And when you go on, let's say you had a car accident or you had a work injury, and now you can't do the things you used to love, right? Maybe it's a permanent injury that affects your family life. And then you start having psychological issues that come with it, depression, maybe your family life falls apart. You don't get to do the things you used to love, like play baseball, basketball, whatever. And all these things affect us. And then when we start going on medications, that becomes also kind of a secondary gain of those medications, because it dulls that down too. So the treatment of pain, especially in chronic, is a comprehensive solution that involves a change in perspective, not just going to get your pain medication, but finding solutions, finding proper OT or at-home care to allow people to find joy back into life, talking about psychological counseling and everything else. So it's a very, very complex subject.
Yeah. I'm going to just open up the box here a little bit. I don't know.
I knew that was coming right after Jordan's politically great answer. Ryan's like, thanks for that. Let me.
I'm gonna get Jordan right off the hot seat and into the frying pan. No, I'm kidding. But here's where I'm gonna make this. I'm gonna tame it as best I know how to tame it, just because I want it to be. I don't want it to be fire breathing for fire breathing. I want it to be like helpful and actionable. So here's what I've found to be true. When I go to a therapist, I've had physical therapy before, and been in pain on something, an ankle. I've broke ankles. I've twisted ankles. I played basketball. Played a lot of high level sports, and I've done massage therapy. And when I'm living a healthy lifestyle, and I go through those things, it keeps me at this plane of healing and like endorphins. I'm getting massage, getting, someone's treating you. You're doing things that are like physically helping you get better instead of chemically depending on something. And the fact that we have these roadblocks to insurance, to things that are not woo-woo, this isn't putting crystals on your head. This is like real, like treatment. And the fact that we have these roadblocks to insurance and coverage on things that practically and realistically are changing people's lives and actually healing them and getting to them a better place mentally and physically, it just blows my mind. What worlds does that make sense? Because that's the world we live in.
So as your wonderful introduction said, I'm also an acupuncturist, and that's one of the areas where there is insurance coverage. But I remember having one plan that reimbursed me $10.
Quick question:
in New York,
has that gotten better in recent years at all?
We have plans. Yeah, we have plans that pay like a reasonable fee, but it spans the gamut, right? And there's always issues of qualifying the care, or how many sessions they're going to give you, and I have several clinics, and a lot of them deal with insurance, and I have a boutique clinic in Brooklyn that is cash only. And I'm moving more towards the cash only model because when you're working within that insurance model, your hands are tied to what they're going to pay you for any amount of time. Just like I said with the physical therapists, is they don't have the time to give you that one-on-one care because they're only getting $30 or $40. And in my facilities, we have PTs that work for us, and some of the reimbursement rates are disgusting. So you have to see, 5 or 6 patients at a time, put them on exercise bikes and e-stim while you have an aide monitoring them. And that's the only way you can actually pay, for the cost of living in a state like New York or California. So it is an issue. And then, one of the things that, I do is dry needling. And there are codes for that for billing. And they do pay, but there's always questions. There's always roadblocks.
Sure.
And some insurance plans, don't pay much for it at all because they don't see the value. And I think it's kind of absurd that they'll pay to keep someone, dull and unable to, be productive in society, and be miserable in pain for the rest of their life, but won't pay a few $100 for care.
I'm going to blend 2 topics in one here because Chris and I do another show right about now, number 1 in marketing and business and on Apple. And so we talk entrepreneurs and all this. If there's ever been a better reason to be in sovereign control of what you do in life and your finances, it's so that you don't have to deal with insurance. And so it's because you can take care of yourself the way you should be taken care of, and just tell the bullshit fucking insurance to get out of the way and come to the specialist for whatever it is. And I mean, I know everybody can't afford that, but it's a sad world, but that should be your motivation alone, because all insurance does is seemingly get in the way. The bureaucracy of it is no different than almost like the government getting their hands in everything that we do now. And so all these institutions that, get propped up as, helping us are just in the way of the most practical, realistic paths to cures and feeling better. How fucked up is that?
No, I agree. And, it can be expensive out of pocket, but effective care yields results. Yep. So it doesn't have to be 3 years of care. You should be getting better. I know with my patients for pain, especially in chronic pain, we start getting results extremely quickly. With my pelvic floor patients, within 4 to 6 sessions, we're done. They might have to go back to PT for training and everything else, but it's fairly quick results because care that works. So if you have an honest practitioner, and you can have honest conversations when you don't have a middleman like an insurance company involved, right? Where you now have to figure out, how much money can you get from the patient because you have to offset your, overhead, your staff, the billing staff and everything else, where you can run on a reduced model and you can just have an honest conversation with your patient saying, my expectations are this. I think within 2 weeks, you're going to see these changes. And if we hit those goals, it's worth paying for because you're getting better. We see a lot of people go to care and there's no results, or there's minimal results, or it's kind of subjective. And that's the model we have now, but the insurance company is willing to pay for that.
The only thing that's cared about is the money.
I know.
That's the sad thing. Is it truly patient care when the solutions are dictated by things that don't care about what the issue is?
Non-providers too, really.
Yeah.
A lot of it is by an algorithm,
Yeah.
Because I'd imagine, like, Doc, when you submit a claim for an acupuncture, I imagine they push back, like, we want medical necessity, we want chart notes. What other failed therapies have they tried? I mean, I see the same thing, like, for example, just to give the audience an example on the lab side that I dealt with, it's very frustrating. We did genetic testing. We swab your mouth and we could tell the doctor which medication's best, right? Pharmacogenetics. Mm-hmm. And after a while, the insurance companies, Blue Cross Blue Shield, for example, not to put them on blast.
Yeah, BCBS.
Yeah, they determined it was experimental, that only after a patient had had 5 failed therapies with antidepressants could they then go to a pharmacogenetic test. So, and you, Doc, you know this, you dealt with someone with depression, five different medications, you're looking at probably 60 days for each medication, tapering on and off minimum. You're looking at a year of trying medications that may or not work. For someone with depression, that is such a long time, where if the insurance got out of the way, doc can do the genetic tests. We, before they prescribe, can tell them, hey, this might be a better choice. That was my big kind of red flag moment in my healthcare time where, okay, this isn't about patient care. This is about saving money for them.
I actually have a personal story about that as well, but we to the point that we submit the notes all the time because they're always requesting notes. So it's just part of the practice now, which means more overhead of humans to go through that whole process and submit them.
More admin and less practicing healthcare.
Exactly. Yeah. And then they read the notes, and the note might literally say, I don't know, take something innocuous. We spent 30 minutes doing the procedure, timestamps and everything else. And it'll say time is not mentioned on it. We're denying the claim. They deny it because it stalls it, and they're hoping it's lost in the paperwork. Yeah. It's insane. And that's United, by the way, just to, throw another insurance company in the mix. But personally, I had a gas capture test for SIBO a while ago. I was bloating like I was pregnant. I had no clue what was going on. Didn't think it was SIBO. Needed Xifaxan prescription. Works perfect for it. There's a lot of stuff you have to do after that. But, I knew how to do that. But I needed a prescription. It happens to be $75 a pill on average. And I need 14 days of it. So, my doctor put it in, regular medical doctor. We had the test. We knew exactly what was going on. They classified SIBO as IBS and wanted me to go on an SSRI. So I called the nurse that administers it at the insurance company to discuss my case, because I was like, clearly you don't think I need an SSRI for a bacterial issue. And she said, well, you need to go on it for 30 days. And I'm like, that's insane, especially with the side effects of SSRIs. I don't have any mental issues. I'm bloating and I have bacterial infection. Yeah. I need an antibiotic. So I actually spent the money myself. It was like $900 to get the medication. And I was like better in 3 days. It was wild. This is the insurance industry. Yeah. This is like, because they have these charts. And I sit on an AI task force. Well, recently I just left it, where we're looking at ethics and AI in medicine. And you're going to see that play out even more, telling you exactly what the right care is and, based on bell curves, what you should try first. And I think there's a lot of pros to AI, but it scares me because it's not going to be used with a human thinking. It's going to be the AI just making decisions. An AI informing a human, that's going to increase medical outcomes. It's going to increase care and comprehensiveness. The AI making the decisions, that's scary. Yeah.
Doctor, I have one other question. Then we're going to get talking about like some of the therapies for how you're taking.
Yeah, I need to trigger you.
Yeah,
right?
you got to trigger me.
So.
Yeah. You did. We got triggered. But last thought here, just curious, like with the people that you see that, relying on insurance, and is there an education that needs to happen that maybe they're using like the value system they use at the grocery store at the doctor? Like they could afford the treatment that would make them better, but they're driven, by value and savings, and they use that same mindset for their own well-being. Is that a real thing?
So I'm going to flip that around to a story that I use when I consult for practitioners for success, because a lot of them have issues pricing themselves in. And it's going to answer that question. And it's a story that a friend of mine gave me when I had that same issue about people spending money on care. And I remember my friend pointed out to me, and she took me to Sephora to shop, which was a nightmare for a guy like me, but eye-opening. And she pointed out how people were spending $500 on makeup, right? And she spent like $500 at the same time. And then she's like, look, they're walking into their Audis and their Q4s, their Q8s, whatever. And she's like, those are the same people telling you that they don't have $500 to spend for 6 treatments to make their back pain go away. Mm-hmm. And it blew my mind because it's literally a value placement. And it's not to knock beauty and, cosmetics. As I get older, I definitely see the value in moisturizing and spending money on that stuff myself, right? But, it's where are you putting your attention? And I think it's because we don't trust medicine anymore, right? Or we have less trust. You know, I'm not going to spend $3,000 on a comprehensive pain package because I doubt it's going to work. It's going to make me feel a little better. And so I'm going to feel a little better if I just spend a $20 copay and just do what the insurance says, right? But I'll spend $3,000, you know, or if you looked at the price of Disney World, you know, you could spend $10K for 4 days for your family down there.
Yeah, there's still a magic though, Doc. You know,
I go to Disney like twice a year. I don't want to knock it, and therefore I know what.
Hey, you need to name.
He's like, hey, but it doesn't get rid of your
practice.
Back pain,
you need to
bro.
name it the Magic Kingdom. Is the name of your practice now?
You know, I'm not going to touch that.
All right.
So, you know, but I will say, you know, the Magic Kingdom is the happiest place on earth, right? That's the line. And depression, anxiety, and all these things roll into pain and pain outcomes and perception of pain. So if we can increase our joy in our life, pain actually does go down. So not going to knock the Magic Kingdom as a treatment, but I feel like I'm definitely personally 1/4 of the price of that vacation for a complete care plan. Right?
Yeah. It just blows my mind. We have to have education on that. That's part of, like, don't get me wrong. I mean, the point of the show is not to tell people to spend more money, but like, if you don't have health, if you're in pain or you're not sleeping well, your life will change if you fix that. And you can go buy all the makeup in the world, and you can buy the Louis Vuitton bag, or you can, you know, whatever. I just can't fathom not. I'm someone that if I have a little something, I take care of that shit. Like I'm not gonna have it get in my way of it. My best optimal performance. I mean, a hangover will do that enough for me sometimes. But you know what? I can battle through that shit. You know, but pain, no. Like, and so we need people to like change that system, because it's just the impact that it has on them and their loved ones is enormous. And so,
but even from an educational standpoint, like you talk about even lifestyle and how we live now in a modern world. You know, one of my free like health hacks that I'm a big proponent of is catching that morning sunrise and getting some sun during the day. The changes it has on the perception of pain, the changes it has on mood, the changes it has on sleep is mind-blowing. Now, for me, in the winters in New York are brutal and bitter. So I'm not out there, and just now we're just hitting that point where I can catch that sunrise and not freeze to death in the process. So I wake up in the morning, go on the roof, I do my Qigong set, my meditation sets in the morning while I'm doing it, but watching that sunrise, because the way light changes the body and sets up our circadian rhythms. And Chris, I see you have the glasses on. So, you know, you see the value, and actually Ryan, I think you have them too. It's so important. But people don't understand this. And if you want to even get crazy, look at the lighting in a hospital. Look at the lighting in a recovery room.
Crazy.
It's blue light fluorescence. They're on to, you know, all hours of the night. That's literally increasing inflammation. Right? We have these closed windows. We don't get any sunlight, barely get even fresh air. There's no fresh air in New York City, so we close those windows.
I can vouch for that.
It makes no sense. So when we're talking about education, the system's so broken that what people think is normal isn't. It's not lifestyle medicine. And then if we talk about trigger points, right, which is like my main area, the amount of people I have that come in for headaches, and it's literally just muscular-based pain. And we can make it go away within a few sessions. I mean, the pain goes away practically instantly, but we have to change some of the postural issues and re-educate them. Instead, people are going on medications for these things, right? And they're just living with it and dealing with it. It doesn't make any sense to me.
How can I get rid of headaches, Doc? I get headaches, not every day. It's not chronic, but I do get them.
So it depends on what the headache is, right? Yeah. So let's just take your normal tension headaches, you know, what we call occipital headaches, frontal headaches, or headaches that kind of wrap around the head like that. The one that wraps around the head like a question mark, that's usually the trapezius. So if you ever had a deep tissue massage, someone's rubbing in there, your loved one squeezes there, and you start feeling it go up the top of your head, well, you have a trigger point. Because what is the trigger point? It's a hyperirritable spot that has autonomic phenomena, which is a fancy word saying that it may affect your nervous system, right? As well as a clear pain pattern where that pain spreads. So while the trapezius muscle in your shoulder doesn't connect to the outside of your eye, it has a pain association and pattern there. And by just going in there with a dry needle, we're doing deep tissue massage and then changing the posture of your head. Because a lot of us sit in front of our computers with that forward head posture, we could deload that and you stop getting headaches.
I get
it's so easy.
Here, like in the temples.
So it's it could be trapezius. It could also be the suboccipital muscles, those ones in the back of the neck. Yeah. And the easiest way is start digging in there. And if it starts recreating your pain and making the headache come, you have a trigger point. Huh. And the easiest way to get rid of it is some sort of trigger point therapy. My preferred means is acupuncture, dry needling. I obviously have a bias, but I'm also a huge fan of deep tissue massage, especially if they're educated in trigger points. But some trigger points are hard to get with the fingers. That's the problem.
What's the most common pain you're seeing, doctor, and like what, and how are you treating? I mean, you just described it with headaches and different trigger points, but what's some of the most common things you're seeing in treatments?
The most common is either low back or neck pain, secondary shoulders. For me, I get a lot of, New York City is a very active city. So you have a lot of people who are running constantly. You have a lot of people that are doing their CrossFit or other exercises, and they're lifting the heavy weights. They're more heavy weights. They're weekend warriors. So we're seeing the injuries more associated with that. And my older clinics that were out on Long Island, which I still have, it was more working class population, and you just saw that low back pain, not so much from working out, but a low back pain from not being strong enough, poor posture, sitting in chairs, sitting on the couches. And then if you have kids, lifting your kids, which is a 50-pound, 60-pound weight sometimes, and you weren't conditioned for that. Especially if you're a new mom, your conditioning was poor posture because you had a child in you, which changes your posture. And then you go right from there to picking up and holding a child, which throws off the back. So those are the type of things that I see that's extremely common. I mean, low back pain is one of the most common conditions that people have, but it comes in many flavors. That's the thing, right? And figuring out what flavor responds to what is the key, and you need a good diagnostician. And that's one of the failings of modern medicine is you go to your general practitioner, your family med doctor, it's like, okay, you got pain, go see PT. If you got a good PT, they might identify it, but then does your insurance cover the appropriate care? If you're paying cash and you go to a good PT, they're probably going to start working on it. Or you go to an acupuncturist, but are they educated in back pain? Do they have the proper solutions for it? I am a professor of orthopedics and neurology at a school where I teach acupuncturists, specifically treatment of orthopedic diseases. It's an extremely complex subject. So there's the bare bones of cutting off pain, and then there's the detail of actually getting people better. And we know there's specialists in every subject. So we need to find a specialist for the specific things. Find the good knee doctor. I'm not the best at ankle pain. Just be honest with you. It's not a thing that I'm that good at because I don't see ankle pain as much. So if you're coming to me for it, I might look at it, know how to assess it, and I'll probably refer you out if it's not getting better within a few sessions. And that's the sign of a good doctor, is a person that has a good team. I was getting treatment today for myself, craniosacral therapy, something I love. It's great for the nervous system. It's great for fascial restrictions and a lot of pain. So I try to incorporate it as part of my wellness care. And they were talking about a patient they had that had pelvic floor dysfunction, and being a pelvic floor expert, they were looking for a PT. And, right off the bat, I had like 3 or 4 different names right in the area that I could tell them to refer their patient to. You have to have people that have good teams. And sometimes family med doesn't have these teams. They have the doctor that they have a good relationship with, who might be a nice doctor. Here's your ortho. He's good for all ortho things. Orthos are surgeons. Chronic pain is typically not surgery.
Yeah. I went through that same thing when ankles and other things. And it's just like, it's kind of like you're building a garage and you got your toolbox, of tools, and you need a tape measure and a screwdriver, and all they got's a hammer and a saw. Mm-hmm. I don't know if it's the right tools, but you trust your doctor. You like your doctor, like you said, you nailed it. And it's like and that's sort of the point of this show. Everybody needs more tools in the tool shed, knowledge.
A good medical doctor friend of mine, I remember I was asking him questions about medical education. I used to have a practice with him, and the way he answered it, as far as competencies, he said, "What do you call a doctor who gets a C+ average?" I'm like, "Oh, I don't know." And he's like, "Doctor." So you don't know, right? And I mean, passing scores doesn't necessarily mean outcomes, right?
Yeah.
But we have to start. As an educated consumer, and unfortunately, medicine is a consumer-based industry.
Yeah.
You have to become an educated consumer and ask the right questions. Hey, what do you know about trigger points? Ask your family med doctor. You might get a blank stare. Or ask your ortho when you go there. Hey, do you think this is, a trigger point? I mean, get a workup, get your MRI, make sure nothing's wrong.
Yeah.
But I think I forgot the statistics, and I quote it every time I'm teaching one of my ortho classes. But over 25, if you do MRIs on asymptomatic patients, which means patients that have no pain and no history of injury, I think it's like 50% you can find a herniation on their spine. Mm-hmm. So then you say you have back pain, you go and you get an X-ray, and they find a herniation, and now you're like, oh, I have an L4, L5 injury. That's why I have back pain. But meanwhile, the back pain doesn't match the radicular symptoms or the nerve-based symptoms, and it's not associated to that. So you're doing a treatment for herniation when the treatment might be a psoas issue and a postural issue. So you need diagnosticians, and the education is quite poor. And one of the other things I remind my students of is that all testing exams, licensing exams, are minimal competency exams. That is the exact language, minimal competency. You are minimally competent now to practice without killing someone. That's where education starts, right? And it's not the malaligned. I took a minimal competency exam as well, right? Sure. Even though when I took mine, I had a master's, so I was like, I'm a master. I know everything, but I'm minimally competent, right? Even though I'm board certified and everything else. Then you have to do your education, find what works. And I remember my mentor said, after you saw 1,000 backs, you'll know how to treat back pain. Because you need to see all the flavors that comes in and see what works, see when it doesn't work, see when you're failing, and be able to have an honest conversation that you're failing as a clinician. When was the last time you had a doctor tell you, yeah, I don't know, it's not working, let me send you to someone else? It's rare that you have that conversation.
Yeah, it is. But I will say I have two of the best doctors. I have a couple. One that's, more longevity. And then I have my day-to-day. I've been going to an internal doctor for 20 years. Trey DeBose. I'll get Dr. Trey DeBose. He's amazing. But I know I'm in the minority there because it's just, I don't think that people get the care that they think they're getting sometimes. And I think it's just because it's education between it. And it's even, like we've had people on the show, Chris, when we've talked about nutrition, like with a doctor. And it's like, like that's the real problem. And most doctors can't talk nutrition, like that's not.
Or exercise.
Exercise, nutrition.
I think nutrition, it's 30 hours of education now. I think it's gone up where it used to be like 2 hours up to like 2,000. And now it's minimal education. And then education on supplements, education on herbs. All right. So I'm also an herbalist and I do a lot of supplements. And, the amount of times I've seen patients be like, well, I want to ask my doctor first, which is fine. Go ahead, ask your doctor. He's not going to have a clue. And then the good doctors will actually reach out and say, hey, here's the medications you're on. Are there any conflicts? And then we can have like an educated conversation about it. But some doctors are like, oh, yeah, I don't know. Don't take it. All right, sure. It's sad because why not have a good conversation? Why not say, hey, here's an educated individual. Let me build a relationship so when my patients ask herbal questions, I have someone that I could just call just as a clinical reference.
What's the path? Like, it's going to be a broad question that I'm asking for a specific answer. Gotta love those. But I think you'll get where I'm going, Doc. So many different kinds of pain. And we've been talking a lot of the episode, about the journey to getting rid of pain and the roadblocks that are there and some of the miseducation and all that. What should be the proper path? Like, what should be the path to relieving pain? Like, where should it start? And, what's the proper funnel for that process?
So first, not giving medical advice. It's just a friendly conversation.
Yeah, we have that disclaimer at the end of our show too.
Yeah, okay, yeah. Cover my ass, right?
Yeah.
My lawyer will be happy about that.
Yes,
so,
we know we're not talking about any one patient here or anyone that's listening. We're just saying, this is all opinion.
If it was you, what would you do?
If it was me, I'm the worst patient. I'm the person. On my Substack, I blogged extensively about having my gallbladder removed and trying to keep it, as I ignored that pain forever, thinking I could go through it. So I'm the worst person. If it's me, I ignore it. The right way is, first of all, it depends. If you just fell off your bike or something just happened in a gym, go get it looked at. Go to your GP, your family doctor, get your basic X-ray, MRI. Make sure you didn't do something dumb, right? The thing is, when you go there, don't be afraid to push back. Say, hey, if the X-ray says there's nothing and your MRI says there's absolutely nothing, maybe I don't need to go on ibuprofen 800 for the next month and a half because there's inflammation. Is there a different way? Is there something else I could do? Or, how do I go about it at the most minimal effective dose so I don't have side effects? If it's chronic pain that you've been dealing with, you have to find the appropriate portal of entry, and that changes in each state. And portal of entry depends on licensure and everything else. Some states you can go directly to PTs, right? You can go directly to acupuncturists. You can go directly to a chiropractor. People that might be a little more functionally oriented and get a proper assessment. However, I will say, if you're going to any of those and you're not getting better, then you go back and demand imagery. Just make sure it's nothing, because there are cases of low back pain that were cancerous tumors, right, that I've seen. There's, shoulder pain that was a mostly torn tendon. So they would get better and then would get worse and keep coming and going. And in which case the appropriate avenue is surgery. And then a comprehensive care plan on the way out, which is usually larger than what insurance is going to pay for. Right, not just enough rehab that your shoulder moves again, but appropriate rehab that your shoulder is normal again. So I think comprehensive workup, someone who's educated that can look at all the possible avenues. And if you're in a lot of pain or you just did something dumb or an accident, just get it looked at by a regular doctor who can order labs. Now, in some states, acupuncturists can order labs. I'm also licensed in Florida. I can order any imagery. Chiropractors often can do that as well. Just make sure they're educated and they know what they're doing. Right, I wouldn't go to the reproductive specialist for labs for a shoulder injury. Right, yeah. So that would be how I would say to handle it. But don't ignore things. That's the worst. And I'm speaking from personal experience. That's why I'm missing an organ now. Ignoring pain is a dumb thing to do.
I know you mentioned pelvic floor, and that's not, I know what that is. I've worked, in marketing business and actually worked with someone that did that kind of work on women. So I know probably more than most just randomly because it was a client at one time several years back. But it piqued my interest when you talked about the education, especially with men and their health. I'd love to delve into that as we sort of start to close out a little bit here, Doc.
Yeah, so my hyper niche area is pelvic floor dry needling, right? So that's using small acupuncture needles to go into tight muscles to release nerve entrapment or to release hypertonic muscles that are causing dysfunction and pain. And that's part of a larger care approach that would be with a pelvic floor specialist PT or someone else that's helping with a larger care plan. So about 60% of women suffer at some point in their life from pelvic floor dysfunction. Pelvic floor dysfunction can manifest in pain, urinary leaking, painful sex, organ prolapse, uterine prolapse, bladder prolapse causing urgency. But for men, I think in one of the more recent studies, I think it was about 17% of men will suffer from it. Now, we don't have uteruses. We don't give birth, which is one of the major causes of pelvic floor dysfunction in women. But, we do lift heavy things. We like to do our deadlifts, our squats. We like to ride bikes. And all these things actually create tension in the pelvic floor and create numbness, weird testicular pain. decreased sensation at the tip of the penis, hard flaccid syndrome, which is where the penis seems almost erect all the time, but not priapism, painful ejaculation, painful defecation, and guys, which is like, oh, I don't know, I lifted heavy, and we ignore it. Or, maybe I was constipated and that's why it hurt when I just went to the bathroom, right? Or, oh, I had a really great orgasm. That's why it hurt. That's not good, right? And one of the things too, if you think about male enjoyment of sex decreases over time. That's part of hormones and everything else as far as the quality of orgasm. So we attribute it to just aging. However, a lot of that is decrease in nerve sensitivity and tension in the pelvic floor. So we find that men actually have an increase in quality of their sexual experiences after releasing the pelvic floor. And what we see, if you do any pelvic floor vices, do Kegels, bridges. I think Chris and I were talking prior to recording, where bridges is starting to become a thing, in stabilizing the pelvic floor when we're working out. But those are things to increase tension in the pelvic floor. We have to have a proper ability for the pelvic floor to contract and relax. And for men, a lot of our issues is contraction. It's stuck, contracted. So it's learning how to soften the abdominal wall. Breath has a relationship to the pelvic floor, and we'll actually start softening it, as well as doing proper stretching, right? Which, I'm guilty as the next person of stretching. I know when I do my deadlifts, I do some nice little stretching after, but, stretching those adductors and everything else, we ignore it. And how do you stretch your pelvic floor? Stretching the psoas is very, very hard to do efficiently. Right, we can get into it, but efficiently releasing it is very hard. So, one of my main things is really raising awareness for men, not just women, that there are solutions out there. It's becoming more popular for women because they suffer more from it. But men, we don't even pay attention to it. Having weird testicular pain just seems normal, right? I don't know, felt funny. I lifted hard, no big deal.
Men are the worst about I think it's gotten a little better with proactive care, but the worst of really taking care of yourself.
TRT being one of the major things that are, that most men over 40 now, that take care about themselves are on it. And it's strange that the TRT doctors aren't aware of pelvic floor symptoms for men. Right?
Yeah.
So the awareness level is still so low.
Well, that's why we have this show.
Exactly. That's why
there.
I'm out there.
Yeah, exactly.
And that's why I'm going on these podcasts, just making sure that people know that there are solutions out there to start looking at trigger points, to start looking at, more targeted approaches, and start demanding more from your healthcare provider. And I think that's a major issue right now. Those who are super into their health are demanding more, but just like you said, you have a great doctor. I have a great doctor because of telemedicine. And in New York, there are a lot of great doctors, but sometimes it's hard to find them. So I have to get a doctor that's in Minnesota, I think, a state I've never been in, who's phenomenal. And I could text him and he knows everything, but he's also willing to hear me out. Hey, I think it was this I was looking at. All right, well, let's do a lab test. But you know what? Paying out of pocket for those labs, because my insurance, which I have a good plan, is no, you don't need to look at reverse T3 on your thyroid. It turns out my reverse T3 is high because it's elevated under stress. Well, insurance companies don't care about that. They're like, your thyroid's normal because everything else looks normal because they're only going to test for the basics, TSH, T3, T4, maybe, right? These things, are part and parcel to our health, how we experience pain, our energy levels, our ability to work out, our abilities for recovery. But we don't look at these things.
Chris, any final thoughts here for Dr. Barber?
All I know is I'm about to try some trigger point therapy. I got a neighbor they opened a robotic massage place, but essentially it's trigger point, deep tissue with vibration. So it was kind of interesting that they approached me Tuesday and told me about it. And then now we're talking about it. So that'll be my first kind of trigger point therapy. So I'm stoked to try it.
Yeah, vibration works. And I've been seeing the robots showing up in New York City. I haven't tried it. I'm admittedly a bit scared. So,
it's a neighbor of mine, and he claims it was great for his personal pain. So he opened up a franchise down here. He's from Michigan. So they're like, hey, come check it out. We'll give you some vouchers. I was like, all right. Okay. I'll give it a try.
Did it want a tip?
I'll tell you, I'd still rather deal with the human, if I'm being honest. But I'll go try, and then we'll get them on the show, and you can listen to the episode.
Yeah, there's nothing like Olga digging into your shoulders, you know.
Yeah, exactly.
You know, I want to say I really enjoyed talking to you guys today, and it was kind of a refreshing conversation because I like very organic conversations, which I think this was great. You know, and I focus on trying to raise awareness on pain and solutions for pain. But I think we spent a lot of time talking about those deeper systemic problems, which was kind of fun for me. And I think it's great that you guys are out there having an audience that is willing to listen to someone like me, you know, talk about these things. And just, you know, my hope is that people just ask for more and educate themselves. Totally agree. Doctor, where can everybody keep up with what you're doing? You can find me on all social media, some more than others, at jbarberlac. Otherwise, drjordanbarber.com. You can find me there. Reach out. I'll talk to almost anyone. Thank you so much, Doctor. Education is important, and that's what we're trying to do. We really appreciate you coming on. I appreciate it. It's been great. Hey, guys, you know where to find us, vibescience.com. We've got a new site there, and it is beautiful, and more than that, it's empowering. We've got all the knowledge from great guests like Dr. Barber. We've got links to Chris and I's profiles, videos, insights, takeaways, and key sparks from all of the content we've been doing the last couple of years. We're here to empower you to your highest vibe. We'll see you next time on Vibe Science. The content discussed on this show is provided for reference and educational purposes. The content is not an attempt to practice medicine or provide specific medical advice. Always consult your personal physician for medical advice and proper diagnosis.
Thanks for listening. This is Vibe Science. To learn more or watch full episodes, visit vibesciencepodcast.com. Here's to discovering your highest vibe